the story about this video is we never really intended to make it. We always tried to push it off into a corner, but you guys caught us in our weakness and were like, we want a video about obsgyn. So here we are making a video about obsgyn for you guys, and hopefully it helps everyone in final year because that's who it's intended for. And let's jump right into it.
Today we are back with yet another video for final years, and this is going to be about the approach to obstetrics. First, let's talk about obstetrics. What is obstetrics? It is just related to pregnancy and all the pathological problems and disorders related to it. Coming to the resources, it is Datta. Blindly you can do from Datta. But we also did a comparison between Datta and Mudaliar. Later in the video, you can check that out. We would suggest Datta. Now, coming to the topics, it is always better to divide your obstetrics into three parts: natal, antenatal, and postnatal. Natal is the delivery, the actual labor. Antenatal is all the conditions before it. Postnatal is all the problems and the things associated immediately after the delivery. The antenatal topics include vomiting in pregnancy, the abortions, antepartum hemorrhage, and hypertension, diabetes in pregnancy, anemia in pregnancy. These are the few important things. Coming to natal, normal labor is really important, and then the abnormal presentations during the labor is also important. To postnatal, there is normal puerperium and then abnormal puerperium. There is postpartum hemorrhage. These are essentially the important essays that you need to cover in obstetrics. And apart from these, there are many small topics, many two markers, many named signs and symptoms that you need to know. How do you go about with a topic? Coming to that, you can divide all the topics into a definition and then etiology, pathogenesis or pathophysiology, and then signs and symptoms, that is clinical features, investigations, diagnosis, and then followed by treatment. Treatment usually would be medical or surgical depending on the topic, and you need to know when to terminate the pregnancy, when to deliver the baby, and if you're delivering preterm, what precautions you should take. These are like the important things that you should know about the topics. And always start your obstetrics with normal labor. Normal labor is essential. Every MBBS graduate should know about it. So start with normal labor, understand it properly, and then go to all the problems associated with pregnancy like antenatal hemorrhage, postpartum hemorrhage and all. And once these are done, you can go to the abnormal presentations. Abnormal presentations are a little tricky. For that, you need to know the mechanism of labor properly. So once you know it, you will be done. Also make proper use of the flowcharts that are given in Datta because they are very helpful for your final exams to revise. Coming to some common topics that are shared by both obstetrics and gynecology, like the abortions, the birth control methods, etc. It is better to use Datta instead of Shaw if you are using Shaw for gynecology because it is given properly and in a very elaborative manner in Datta. That is really helpful for your exams.
So many of our subscribers asked us for a comparison or at least a reason why we use Datta when compared to Mudaliar, and the reasoning for that is because Datta has these tables and flowcharts and in general a little more organized information, which is why we chose Datta. But we're gonna try to compare the two for you. I'm sorry, both of us did not read Mudaliar as much as maybe someone else has, so it might come off as biased, but hopefully you'll agree with us after we've shown you a bit of a comparison between the two. So this is our comparison video. This is Mudaliar and this is Datta. So we're here to compare the two textbooks, and obviously the first difference you'll see right off the bat is I didn't read this, but I read this. I'm not saying that this is a bad book. I'm just here to show you the differences between the two. So first things first, you can clearly see that both have information. It is not that they don't. Both have a similar, layout, or they have a definition and risk factors and so forth. Both have this going for them. But let's just jump into a little more level than just the information. Let's talk about how they've laid this out and how they've laid this out. You can clearly see that there's a lot more bullet points here, and it helps you organize information a lot faster. Here, they did have tables, it's not that they didn't, and they do have highlights. But I think the biggest difference that I felt that was really specific to data, which helped us a lot, was these flowcharts. These flowcharts are the reason why we were able to present better. And there you go. This page that we are seeing right here, we ended up filling up notebooks with just these types of flowcharts, these types of managements seen throughout the book for different conditions, and place them together so that we would have an easy time defining managements between conditions, because sometimes they can all kind of seem similar but are very specific only to the condition that you're reading. So we needed to know the differences between management between different obstetric conditions, and that was helped because of these types of flowcharts. And yeah, see, you can go right here into the anatomy that's being described, and that's why we think that Mudalaya is not as great, at least not as great for the essays as Datta is. So hopefully you got an idea. If you like Mudalaya, go ahead, but we don't really agree with it for at least the essays. We like the essays in Datta. Maybe the shorter questions are probably your safer go-to for Mudalaya rather than the essay questions. So hopefully that clarifies anyone's doubts, and thank you.
Coming to practicals now, the practicals of obstetrics are the easiest practicals you'll ever have in all your 4 years. The only thing is you need to know them. So please attend clinicals. However bad your college might be, however bad the number of patients in your college might be, there always is a pregnant woman. So go to the clinicals, look at the patients, try to elicit the grips from the beginning, try to identify the fetal parts. This will help you in remembering things better. And if you see a patient with polyhydramnios, or if you see a patient with twins, you can ask them their symptoms. That way you'll remember the signs and symptoms in a better manner, especially in this subject. Kindly attend the clinicals and then go about it. And then coming to the proformas and all, they are provided by your respective colleges. There is not really a need for a separate practical book that you need to buy. You can make your own notes from the beginning. And whenever you see a case, make sure you read about that case in the textbook the very next moment, in that day, because this will help you retain the knowledge very, very well. Coming to the concepts that you need to know for your practicals in obstetrics, they are antenatal assessment of the fetus, fetal skull and pelvis assessment, and then cephalopelvic disproportions, VBAC, and all the pharmacotherapeutics, all the drugs you need to know. And then you need to know the operational procedures, especially the episiotomy and LSCS. You need to know this before you attend the practicals. They are very basic. You'll anyway know normal labor, so that is fine. Apart from that, yeah, Bishop's coding is very important. Uterine rupture and the rings that form in the uterus, the instruments, and then procedures. Procedures are favorite of examiners. So they'll ask you about episiotomy, LSCS, why LSCS, why vertical, why horizontal, which is preferred, advantages, disadvantages, and then comes this forceps, ventouse, hysterectomy indications. So there's a few things that are must know for your practicals. Apart from this, almost all your OBS cases are the essay questions. That is, either it will be an antepartum hemorrhage or twin pregnancy or polyhydramnios or anemia, or it can be a simple primary gravida in labor. This is going to be very easy if you attend the clinicals from the beginning. and that is about obstetrics.
Hey, so before you leave, please like, share and subscribe if you liked our video about obstetric. We'll try to keep coming with more and more content for you, so thank you so much.